morning, everyone. Today we have Harry, which we just extracted the follicles. We're targeting a brand new hairline, zone 1, zone 2. We were aiming about 2,800 to 3,000 grafts for Harry. So the extraction process has already been done. We actually have our count. We ended up with 2,937 grafts. And
Nice.
total, you have almost 80% doubles and triples. Okay, so you have about 40% doubles, 40% triples. It's a good ratio. Knowing that you had a little bit of a thinner donor, you actually have above average percentages. So
Nice.
how was it for you?
Actually, more than 10 years, I was like thinking and checking, searching. I did the best decision. I didn't realize it would be very easy and very nice.
Nice. Thank
Yeah,
you. Discomfort, pain-wise, 10 being very painful. How uncomfortable was the extraction process? And you could be honest.
2
2 out of 10?
out of 10.
And
Maybe 1 also because it was very easy.
so you have a good
I was
tolerance
I was thinking like gonna be crazy and tough. Was very easy and
Good.
honestly, I'm very happy for my decision.
Good.
Yeah,
Thank
I'm
you for
very
volunteering,
relaxed.
for sharing your story as well, Harry.
And I hope I did like 5 years ago.
5 years ago,
Yeah,
15 years ago. How long have you been losing your hair?
15 years.
15 years.
Yeah.
Okay. So
Yeah.
you're gonna look at least 10 to 15 years younger in about 6 months'
Nice.
time. Okay. So Harry, we're gonna do your first half of the scalp. We're gonna future proof, and then in about 9 months to 12 months, we'll see you to do the back. Okay. It's never a good idea to do the entire scalp all at once. It can be done, but we don't recommend it because of the blood circulation. We want the body to do 100% either the first half or the second half. Starting in the front always is the best decision because you're extracting the follicles first and you want to use it somewhere where it's the most visible, which is the front, because what we do take does not regenerate back in the donor. It starts growing where we place it. So Harry, right now, what we're gonna do is we're gonna take a few measurements of the face. I want to measure the distance from your chin to tip of the nose, tip of the nose to eyebrow, and place a hairline that's going to balance your face. Not all hairlines are the same. We don't want to take a laser or a ruler and draw a straight flat line. So we have to consider your donor, your age, how much loss you have, and also personal choices as well. Okay.
I trust you.
Thank you. I appreciate it. Thank you for coming all this way as well. I know. Did you come from, was it Dubai?
Dubai.
Dubai. Alrighty. And yeah, we'll start the design phase.
Thank you. Thank you for everything.
You got it.
Thank you for everybody. Salute.
All right, Harry, turn slightly this way. Bring your chin down a bit. I'll give you a few options. Okay. Almost 14 and a half, almost 15. Perfect hairline could be anywhere from 7, 7.5. Bring your chin down a bit. Have you thought about the type of hairline you want? Aggressive, mature, recess? We'll give you a few options. Right
Okay.
now. Bring your chin down a bit. I'm gonna ask you to raise your eyebrows for me. Raise your eyebrows. Raise it as high as you can, and we can relax it. Perfect. Bring your chin down. All right. And we're gonna do a few options. Sometimes we like it on the first attempt, sometimes we'll do 50. So spend a good amount of time. Bring your chin down a bit. This is at 7.5. Bring your chin down. Let me have alcohol wipe. Thank you, thank you. And I think, Harry, you wanted a more of a mature hairline, right?
Yes.
Higher hairline. You don't want something that's too low or aggressive, which I wouldn't recommend for you anyways. Start sliding this way. I don't like any of them, so I'm going to start from scratch. Bring your chin down. Bring your chin down. Okay. I like this one much more than the previous one. Let's tweak it a little bit. Bring your chin down. This looks really good, actually. Alrighty, and then I'll do something different on your left side,
Okay.
just so you have options, okay? And you tell me which side you like more. And by the way, Harry, you never want to have an identical looking hairline, okay? The right and the left should look similar, but not a mirror image of one another, because in nature, nothing is identical. Our right side and our left side is slightly different. Alright. Bring your chin down a bit. Beautiful. Alright. This way. Bring your chin down. Bring your chin down. Pause, please. Thank you. Bring your chin down. All right, Harry. So let's give you the mirror.
Okay.
And let's show you two different options of the hairline. One is a little bit more aggressive. The other one is a little bit more mature, a little bit slightly higher. You can tell me you don't like any of them. That's okay. Or you could tell me you like the left side more than the right, or you like the right side more than the left. Your right side is slightly lower, more youthful. Left side, slightly higher. You see the difference?
Yes.
Which side do you like more? Raise the eyebrow. Raise your eyebrows. Raise it, raise it. So this one is very close to your old hairline that you used to have. If I was to trace it, it was just like that.
I think it's better.
Yeah.
What do you think?
I like it. So this is just, I don't like this side. I did like it initially, but I feel like it's gonna be a little bit too aggressive. Let's raise this side up a little bit and make it closer to what you had, not what you've never had. What you have never had.
Yeah.
Make sense? All right.
Beautiful. I trust you.
Thank you. Bring your chin down a bit. Let's tweak this side a bit and see how this turns out. Okay. If I can please have a marker. Thank you, thank you. Bring your chin down, chin up a bit. Get your chin down. All right, let me show you which side you like more, okay? Can you see the difference?
Yeah.
Which side do you like more? This is higher. This is more youthful. I like both, to be honest with you, but I think this is what you're going for.
Yeah.
Am I right?
Yeah.
Okay.
This is more higher.
This is higher.
Yes.
This is more youthful. They both are gonna look good, but
Yeah.
I think this is what you wanted. That you didn't want to change your look too much. You just want to reinforce what you have. Sounds good?
Yes.
All
Sounds
right.
good.
So now what we're gonna do is we're gonna change this side to make it look more like the right side, but we don't want it to be a mirror image. We want some irregularities.
Sure.
Okay.
Sure.
All right. So I think we have a winner. Okay, bring your chin down a bit. Perfect. Your right side is very similar to your left side, but they're not a mirror image. We don't want it to look like someone took a ruler. If I can have a mirror. By the way, this is what your hairline looks like. Do you like it?
Oh, well, nice. Beautiful.
Okay. So this is the final, close to the final. I'm still gonna place the little softeners like this that go in front of the line to make it look even more jagged and irregular, okay? So we're gonna go all the way across to break that straight line look. One thing we don't wanna do is what we see all the time is taking a ruler, going a flat straight hairline or tracing over a laser. This is something we stay away from just because, number one, this is the easy way out. Number two, this isn't gonna be suitable for everyone. Okay, it shouldn't be suitable actually for anyone, but
I trust you. It's an artist job.
thank you.
Beautiful.
So we spent a good 45 minutes designing your hairline. I really like this. You have more loss on the right side than you do on the left. So your distance from the center to here is 8.5. From here to here, it's closer to 8, okay? And I gave you a location for a hairline that gives you equal proportions, okay? So if you look at the distance from your chin to eyebrow, you're gonna see how that's 15 centimeters. You see that?
Yes.
Okay. So that tells me if this is 15 and we want to balance the face into an equal 1/3, that this is 7.5, This is 7.5. Together I have 15. And to balance your face from the eyebrows up should be at 7.5. So if you look at this, 7.5, do you see that?
Yes.
That's 7, that's 8. The line is right in the middle at 7.5. So I actually did the design before taking the measurement, and it turned out that it was actually where it should be technically. Okay, so if you like this, I'm gonna go over it with a surgical marker. We're gonna disinfect the scalp one more time. We're gonna break down the zones and we're gonna get started. You're halfway done.
Let's go.
You're halfway done, okay? In about an hour and a half, an hour and 15 minutes, you're gonna be 75% done. Then you're gonna have lunch, Harry, and you get to home after the implantation. We forgot the implanting part.
Thank you.
Incisions, lunch, implanting, then you go home. Not after lunch.
They treating me like a king.
Thanks, Harry.
Thank you.
Harry, now that we agreed on the hairline, I'm going to go over it with a permanent marker, okay? I need you to keep your head nice and steady and then break down the zones. Don't move. We're going to fill all of your zone 1. Turn slightly this way. Zone 1 is the first 2 centimeters behind the hairline. And then there is zone 2, which is the following 5. So you're going to get total coverage of 7 centimeters. And we have a blow dryer. Comfort. Chin down. Bring your chin down for me here. And the comb, please. We're going to do these corners for you as well. I know that bothers you like that. And then we're going to do this corner for you as well. I know that bothers you just like that. We're going to fill that. We're going to fill this. And we're going to do your zone 1 and your zone 2 and the brand new hairline. All right, here, let's go over the plan together. And if I can please have a mirror. All right, and if I have a marker one more time, please. Hold the mirror for me here. So what we're going to do right now is I broke down your zones, and we're going to give you a brand new hairline that's going to go like this to the side and drop to the temples. This is called the temple angle closure. This is what's going to really frame your face. Okay? I don't want to give you a hairline that goes towards the back. It goes from the side and drops to the temple. So you have this frame, not that frame, which gives more attention on the forehead. Okay? So brand new hairline, drop to the temple. Brand new hairline, drop to the hairline. Right side and the left side should look similar, but they should not be identical. That's one of the reasons why we're placing these softeners in the front, to make it look jagged and irregular. We're going to fill all of this right side of zone 1. We're going to fill all of that left side of zone 1. We're going to future-proof this little small area that you have. In case you lose this, you're going to have follicles around it. Then you mentioned how there's this part way that you don't like next to zone 2. So we're going to focus this corner here. This is almost like a corridor, an alleyway. We're going to fill all of that up. You mentioned the same on the left side. We're going to fill this. And then we are going to do all of your zone 2. It's pretty thin. We're going to future-proof it. Zone 1 is the most important out of the 4 zones of the scalp. We're going to do a natural density of at least 70 to 75 grafts per 1 centimeter square in zone 1. Zone 2, we typically do half of natural density compared to zone 1, just because everyone has a limited donor. So what's taken from the donor, Harry, doesn't grow back here again, it grows where we put it. So when a client such as yourself needs a procedure in the first half and the second half, you can never ever do 70 to 100 grafts all the way between zone 1, zone 2, zone 3, zone 4, because that's going to chew about 25 to 30,000 grafts, which no one has that much to donate. So zone 1 is the most important. It's what frames your face. We have to do natural density of at least 70 to 75 grafts per 1 centimeter square. When it comes to zone 2, we're going to do half, 35. So you already have some pre-existing hairs in zone 2. By doing 35, it's actually going to look like natural full density. And we're also going to do the corners. And I'm also going to do PRP and stem cells exosomes for you as well to help with the healing. Sooner growth, minimizes shock loss, so these are the benefits. My favorite, higher survival rate of the follicles is what we have seen. Okay, clients who do PRP stem cells with the procedure, exosomes, their results are coming in much stronger and much sooner and faster than versus without. Do you like what you see? Do you approve?
100%.
You like it?
100%.
All right, so you're halfway done. In about an hour and 15, hour and 20 minutes, you're gonna be 75% done. You're gonna have lunch. What'd you order for lunch?
Salmon.
Salmon, good. And then after lunch, we finish the day with the implantation. And then you go home. We'll see you tomorrow for a follow-up, and you're a free man after that.
Thank you. Thank you, all of you.
All right, Harry.
All right.
Have you had your head shaved before?
Never.
Never?
First
All right.
time.
Here we go. First time for everything. You might like it.
I don't think so.
You actually have a good head shape for it, Harry.
Yeah?
If you want to change your mind, we'll donate your follicles
No,
for the next procedure, no?
This is what I was dreaming.
And we had asked Harry to dye his hair as well, to color it, just because he has a little bit of salt and pepper hair. Turn slightly this way. All right, Harry, I'm gonna outline the design. I can't have you move the head or shake the body. Keep the head as still as possible. Now that we like the design, we're gonna trace it and we're gonna finalize it, okay?
Okay.
So, here we go. Bring your chin down, chin up a bit. Okay. All right, Harry, I'm just putting the final touches, okay? I'm a little too picky when it comes to the hairline and the design. Can I please have alcohol? Look towards me, look down. Okay, fresh glass, please. Thank you. Marker. Alcohol, please. Alrighty. Bring your chin down. I love this on you, Harry. I'm glad we spent that. It's been an hour now on this design with all the options. This is gonna look so natural on you. It's almost, this is what you were born with. I can't wait to see you in about 6 months' time. You better stay in touch. Okay?
My dreams coming true.
Your dream's coming true. That's amazing. Thank you. Maybe a small widow's peak would be nice. This looks really good. Let me show you. All right, Harry, so now that we finalized it, all that is gonna be hairs, okay? You can hold the mirror for me. So, brand new hairline. Drop it to the temple. Brand new hairline. This is called the temple angle closure. This is where the hairline meets the temple. This is what's gonna frame the face. We're gonna fill all of this, fill all of that, spot treat in between your zone 2, and this is a priority as well. That's a priority as well. Okay.
Very good.
It almost looks like a helmet with the little ears.
I know, I know.
All right, my friend. So, congratulations. You are officially halfway done. Harry, guess what?
I'm so happy.
I have to numb this next portion. Okay? It's really quick, super fast. The way I numb the top of the scalp is I have to do a quick injection here, injection in the eyebrows, half a second, half a second, half a second, half a second. This is going to block a lot of that sensation, okay? So you have half a second, half a second. By the time you say, ouch, it's already done. Same on the left side. 80% of the scalp will be numb. All you have is 3 seconds of pokes here, 3 seconds of pokes here. Then you will feel nothing throughout the entire day. Sounds good?
Sounds good.
Any questions you have for me?
I'm so excited. Thank you.
You're doing all right, Harry. I'm going to disinfect the eyebrow.
Okay.
Okay. And I'm going to do a quick poke on this right eyebrow, and I'm going to do a quick poke on this left eyebrow. Okay?
Okay.
So, this is the worst part for this phase. You're going to get half a second of injection here, half a second of injection here. Half a second, okay? And you're also going to feel a little vibration device, okay? That is to distract the nerves. Push the head back, close the eyes, chin up. Here we go, don't move. 1, 2, and 3, here we go, don't move. You did it, good job. Here comes the second one, don't move. You did it. How bad was that?
Very good.
You felt you were okay? All
Very
right, we're gonna do the same on this left side. Here we go, don't move. 1, 2, and 3, don't move. Perfect. How painful was that? You did great, good job.
Very good.
All right, Harry, you're gonna notice that your forehead is feeling very tight, very heavy,
Okay.
numb. Sometimes patients say even the tip of my nose feels numb.
Okay.
This is normal. Now, this is gonna come all the way to the top of the scalp, okay? So you just have a few seconds on the right side, few seconds on the left side, and that is it.
Okay.
Thank you so much.
Thank you.
Now we're gonna get started with phase 3, which is the incisions. All right, Harry, I'm gonna do the numbing portion, okay? Here we go, 1, 2, 3, you're gonna feel a little vibration. This shouldn't hurt so much because we did the eyebrows. Almost done. You did it, now we're gonna do the left side. Here we go, turn to the right a bit. Almost done. 3, 2, and 1. All done. You did it.
Perfect.
Congratulations.
Perfect.
How bad was that?
Perfect.
It was perfect?
Yes.
Your hairline turned out perfect. Your design turned out perfect without making it look too perfect. Does that make sense? If it's too perfect, screams fake. We want it to be just enough irregularity to give it a natural look. Here we go, don't move. We're numbing. You shouldn't feel anything. Here we go. Any pain?
No,
No? Alrighty.
at all.
Good. Close the eyes. Think of happy, beautiful thoughts. This is where a lot of clients take a nap, okay? You did amazing, my friend. That's it. Good job. No more discomfort, no more pain for the rest of the day. Bring your chin down a bit for me. Chin up a bit. We're gonna follow your natural angles and the direction of the hair. Bring your chin just a tad lower. Beautiful. Let's adjust this. Chin to chest. Beautiful. All right, Harry, you ready?
Yes.
Here we go. 1, 2, and 3. You shouldn't really feel anything.
No, I'm not feeling
We already have 9 incisions. Turn slightly this way. Bring your chin down a bit. Beautiful. Any pain?
No, at all.
Good. And you're barely bleeding. You're gonna have amazing results in about 6 months' time, Harry.
Yeah.
Can you believe you're here today?
No, at all.
You always comment on our Instagram.
Yes.
Give us a thumbs up, a like, and now today is your day.
I told you, more than 5 years I was
Researching.
looking everywhere, asking, you know.
And what made you pick us?
I saw a lot of comments, and I have mutual friends. It's your customers, and they told me it's the best result, and I saw the results. And
Thank you, my friend.
I decided.
I know you have a lot of options. We appreciate it. Alrighty. Right hairline is almost done. Now we're gonna do the closures. Bring your chin down a bit. Perfect, perfect. Alright, Harry.
Yeah.
We're almost done. You're gonna have lunch next.
I know.
How has it been? Painful, comfortable?
First of all,
Having a good time?
relaxing, watching TV.
Kif halak?
Alhamdulillah.
How was your flight from Dubai?
Very good. Everything perfect.
Everything was good?
Exciting. I came
How many days are you in town for?
6 days.
6 days. You know it has to be 7 days. You got to change that flight.
Yep.
If your flight time is more than 6 hours, because most of our clients are not from LA, from different parts of the world. If the flight time's 6 hours or more, they have to stay 7 days in LA. If it's less than 6 hours, they could leave the next day. I got the rest, Ian. Thank you, thank you. So you got to change your ticket by a day.
No problem. I'm happy.
I'm very happy for you. Everything went super duper amazing.
I don't. No pain, nothing.
Alright. What has been the worst part so far?
Honestly, nothing. Everything was perfect, smooth.
Amazing.
I didn't feel anything. Very comfy. Everybody respectful, helping.
We're gonna break for lunch in less than 1 minute, okay?
Nice.
And we're gonna do your PRP stem cells. Well done. Congratulations. You did amazing, Harry.
Thank you.
I know your head's gonna feel super duper heavy. It's all normal, okay? I can't wait for you to see the finished product. When I say finish, I mean for today. And I can't wait for you to see it in 6 months' time. You did amazing. We're going to use the same IV line to draw the blood for your PRP and stem cells, okay?
Okay.
You're all set, buddy. You're going to have lunch, and then we finish the day with the implanting. You did fantastic.
Thank you so
Good
much.
job.
Thank you.
We're going to do the PRP for you right now. We're going to use the same IV line, hopefully, that you have. This is going to spin while you have lunch, okay?
Okay.
And if I can please have gauze, and if I can also have saline push. You're okay with seeing your own blood? You're not going to faint on me, are you?
Nah.
Huh?
Don't worry.
All right, you did amazing, my friend. Do this. We're going to seal this up. Hold it from the gauze for me. I'm going to push this one back in. And you are all set, my friend. You're all good. I'm going to leave this port in until later tonight. We'll remove it before you leave, okay?
Okay.
So you no longer have to have your arm with an IV line anymore. Thank you, thank you. You are all set. Don't play with that. Everything went super duper hairy for you.
Everything perfect.
You
Smooth.
could use the arm, no problem.
Oh wow.
It's bendable, okay?
Nice.
All right. Enjoy your lunch, Harry.
Thank you.
All right, Harry, how was lunch?
Oh, perfect.
What'd you have?
Salmon.
It's my third time asking you.
Salmon.
Salmon.
Baba ganoush.
That's
Tzatziki.
Good. Good.
With
good.
rice.
All right. You haven't seen this design yet, have you? Mari, can I have the mirror, please? Hold the mirror. Have you seen it?
No.
Okay. Do a quick wipe. Keep in mind, what you see now, everything is swollen and it's elevated, okay?
Nice.
All of this is fluid, it's lumpy. Next few
Yeah.
days, it's gonna come down just like that.
Oh wow.
Okay, so about 1 finger, it's gonna drop. Right and the left are very similar,
Beautiful.
Harry, but they're not identical. What do you think? You approve? You like it?
Yes.
Do you like it
100%.
or do you love it?
I love it.
Good. So what I'm gonna do next is I'm going to give the distribution,
Okay.
where the singles have to go, where the triples have to go, because they all have specific placements. I see triples placed on the hairline all the time. A lot of clients, you know, when they go outside the country, what they typically do is they place the triples in the very front, and that gives a very unnatural outcome.
Because
So
of that, I'm here today.
Thank you. I know you came all the way from Dubai. So the front has to be all singles to look natural. Behind it is where we want to place the triples. The singles gives you a natural look, triples behind it gives you density, okay?
Yes.
The center portion was the densest for you. So in case if you ever lose this existing hairs you have in the future, you might need to do about 200 on each side, total 400 grafts, because everything else in front of it, next to it, is pretty solid. Zone 1, and we also got those corners, almost the ones that look like the ear, the
Yes.
part where that bothered you, okay?
Yes.
So I'm going to give the distribution for the team, and then we'll come in and we will do the PRP stem cells, and in about 2 hours you should be done, around 4 o'clock or so, okay?
Thank
4:30.
you.
You
Thank
got
you.
it.
Awesome.
All right, Harry, I am going to go over the distribution, okay?
Okay.
So I'm going to break down and look at the numbers. 750, 750, perfect, that is 1500. And let's see the triples. We have over 1,000 triples, almost 1,100. Okay, so 75% of your zone 1 is going to be all triples going across like this. Then the rest is going to be doubles behind it. Hairline is going to be singles. Hairline is going to chew roughly about 400, and we're going to be left. Alrighty, so here we're going to do a combination of 2s and 1s, 2s and 1s, 2s and 1s. Okay. All right. All set. So Harry, the team's going to start implanting.
Okay.
Okay. And I'll come in and do the PRP stem cells for you.
Okay.
Okay. You should not
Sounds
feel
good.
anything. All right, Harry, we're going to do your PRP and stem cells exosomes. Okay, here we go. You shouldn't feel a thing. Any pain?
Oh.
Good. The benefit of doing stem cells with PRP, faster healing, sooner growth, minimizes shock loss. It helps with the natural native hairs. But guess what? My favorite is going to be higher survival rate of the follicles. Harry, anytime we do a transplant, your body is never going to accept 100% of all the grafts that was implanted or given to you, okay?
Yes.
Some clients get 90%, others get 95, others get 75, others get 80, some get 85. A lot of factors come into play. Your age, what medications you take, any underlying conditions, diet, stress levels, stress hormones, quality of the grafts, blood supply, scar tissue. All of these are conditions of how your final outcome is going to look like. This is why everyone gets a different looking result. When you do stem cells, it's going to help with higher survival rate, along with all the benefits that I mentioned. Thank you, Alexis, such as minimizing shock loss, sooner growth, helps with the natural native hairs, helps with faster healing because we're using the growth factors and the platelets found naturally in your blood, which is their job, their responsibility to do that. You're all done. The team is going to implant. This next phase should be a few hours. Watch a movie, and we will see you for the post-op to go over the notes of how to take care of these grafts until you come back tomorrow, okay?
Thank you.
You're welcome.
Sometimes a hairline can take down an elephant. We will bring the war to them.
Two. All right, Harry, you're almost done.
I know.
How's it going?
Oh my God. Unbelievable. Very smooth. Very nice.
Any pain, discomfort?
Now, watching movie.
Good, good.
Everything is perfect.
You should be done about 5 to 10 minutes.
Oh, nice.
Okay, so you should be done about 5 to 10 minutes. Everything is going super duper smooth for you. Okay, not too much longer to go. We'll see you tomorrow as well for your follow-up. So we'll have you come in tomorrow morning for a checkup, instructions to do the washes.
Okay.
Otherwise, everything went super smooth. I'm super duper happy for you.
Yeah, me too.
And I can't wait to see your 6 months result.
Thank you
We
so
did PRP, we did stem cells, you had over 80% doubles and triples combination, so everything should look amazing, okay? And these guys are the best working on you.
much. I know.
Okay?
Thanks for everybody. Everybody is like
Thank you.
perfect. Helpful.
Thanks guys for watching.
Thank you.
Thank you. Thank you, Harry, for allowing to share your story.
I know.
And for the
And
TP.
my advice for everybody, it's the best clinic ever.
All the
on
way
the
from
world.
Dubai.
If you want to follow along with Harry's journey, all you have to do is follow us on YouTube, on Instagram. His results will be posted in 6 months' time, in a year's time, as his results come in. Congratulations, my friend.
Thank you.
Thank you for choosing
My
LA
advice
FUE
for
Clinic.
everybody, don't scare. There is no pain and very smooth surgery. I love it. Thank you.
my friend. Thank you. Follow us on Instagram, LA FUE Hair Clinic. Follow us on YouTube to see his results. Congratulations.
Thank you. Thank you.